Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County. And like we do every week, this is our COVID Conversations update for the week of November the 12th. We typically do these on Thursdays, but yesterday was a day for a great Veterans Day parade, so we're a bit behind today. So this is a chance for us to answer your questions that people have submitted to us over the last week, as well as a chance to give an update on what's happening in the world, in the country, in Oregon, and here in Douglas County. So when the world cases are clearly up over the last 2 weeks, and we're now starting to see the beginning of a new peak in the world, this is really discouraging because we thought that the peak that we had in August and September might have been our last, but unfortunately in the world, we're starting to see another peak. This peak is very interesting because it's mostly in Europe and Russia, and also a little bit in the US. And it's really led by countries that are in the northern parts, so people above the 40th degree of latitude, so pretty much above Oregon's latitude and above. This is worrisome because these are in areas that are cold, and as they're starting to get cold and people move indoors, we're starting to see an increased number of cases. So a bit of a worry there. So Western Europe, Russia, Eastern Europe are all really struggling with the amount of disease. The good news is that the Southern Hemisphere is pretty quiet, and places in the Northern Hemisphere in Asia that have done well in the past continue to do well. So Taiwan, South Korea, and Japan, which have had low rates of disease over the last few weeks, continue to be low. But this outbreak in Northern Europe is concerning, and it's concerning especially because we're now starting to see some of this in the US. So again, the US had a big peak in July, August, and September. That came down, and so we were at a relatively low rate last week, but we're starting to go up again. And we're seeing that the places where it's going up is pretty widespread. So every day they publish the 50 counties in the US with the highest rates of disease. And sadly, Douglas County was there for a few days back during our peak. But when I look at that today, those 50 highest counties are in 24 different states. So they're very widely spread around the country, some places in the south, some places in the north. The most disease is still in Alaska and in the Mountain West, but those disease in the Mountain West is now beginning to spread eastward through Kansas and the Dakotas. And then places in the past that have not had a lot of disease, like New Hampshire, Maine, and Vermont, are now seeing some of their highest rates. So we are definitely not done with this. And those increasing rates in places where it's already cold suggest that as our weather worsens, we might see an increase in cases. So the country as a whole is at about 22 cases per 100,000 population per day. Oregon's doing a little bit better. We're at 18 cases per 100,000 per day. We had our big spike in August and September, and it's coming down, and cases are coming down. Deaths remain high, somewhat because these are people who might have been sick in August and September and are dying a month after the onset of their illness. And some is because during that time, there were deaths that occurred outside of the hospital that are picked up on death certificates, and those take a while to work their way through the system. Nonetheless, we've had a lot of deaths. So we've had over 170 deaths since August, really a terrible toll. And at this point, almost all of us know someone or more than one person who's died because of this pandemic. Again, overwhelmingly, when we look in Oregon, the cases and the hospitalizations and deaths are among the unvaccinated. So there was a graph that they showed at one of the meetings this week that looked at the case curve for the vaccinated and the case curve for the unvaccinated, and the case curve for the vaccinated is very low. If everyone was vaccinated, we would not have had the big spike that we had before. In Douglas County, we're really flat. So we came down in mid-September, but for about the last 6 weeks now, we've been really kind of flat between 20 and 40 cases a day. Some days a little higher, some days a little lower, but averaging about that number of cases. We continue to have over 20 people in the hospital, although it's down from where it was before. But we still have a fair number of people in the hospital, and our positivity rate, that's the rate of positive tests among all the tests we do, still is a little higher than we'd like, at about 6% to 2 or 3%, and we like our hospitalization count to be far less than 10. In Douglas County, we're at about 25 cases per 100,000 per day, so a little bit more than the national average and considerably more than the state average. In Oregon, it's been pretty quiet, except for the east of the Cascades, and east of the Cascades continues to battle with a high amount of disease. Again, when I look at the world maps, when I look at the U.S. map, when I look at the Oregon map, pretty much places that are struggling are places that have low levels of immunity, and this is what we're seeing. Now, it's interesting that the places that had a tremendous amount of natural disease in the summertime, Florida, Louisiana, Georgia, are now having low rates of disease. But that's probably because people got immune from the disease. But a lot of deaths in that area during this time. So things are kind of flat in Douglas County, a little worrisome in the U.S. and the rest of the world. So we're asking people to be careful when they make their Thanksgiving plans. We know that Thanksgiving frequently involves lots of travel. So you may be traveling out of the county or even out of the state for that. And you'll be mixing with a bunch of other people from other parts of the country. And that's a great thing and one of the wonderful parts about Thanksgiving. But unfortunately, it allows cases to transfer. So we're strongly recommending that if you're planning to travel, please get vaccinated. And if you are at one of these events, if you're sick, please don't partake, because we know that people who are sick are most likely to spread this, especially in the kind of activities that we expect to do at Thanksgiving. Sit around, be inside for many hours, talk, drink, and do those kinds of things, which really could spread the disease. There is some good news this week. Pfizer has come up with a new antiviral drug that looks very promising. So this would be an oral antiviral drug that you would take after you were diagnosed, and it seems to reduce hospitalization rates by 90%. And that's great. I think it probably could be used in addition to the Regeneron. And Regeneron already decreases your hospitalization rate maybe by 70%. So you can imagine using both of these together plus vaccine. In that case, we should very rarely have somebody hospitalized, and that would be the goal. Because mild COVID is nasty. You know, people who've had it, I've talked to hundreds of people who've had it, say that it really was one of the worst illnesses they've had as an adult, feeling achy, feverish, and whatever else. But most people who get sick and within 2 or 3 weeks are over it. What we're really trying to prevent is the people who are so severely ill that they get hospitalized or then die. And unfortunately, we've had way too much of that. The other news in this last week is that the pediatric vaccine, that's the Pfizer pediatric vaccine for kids 5 to 11, has been approved. I looked at the data, it looks really pretty good. It looks like it's safe, it looks like it's effective. It's similar to the adult vaccine in what's in it, although it's got a smaller dose, which is appropriate for kids. The kids seem also to have a tremendous improvement in their rates of getting sick. Now, kids don't get hospitalized very much, but it does certainly reduce the rate of illness. And since we know that young kids can spread it to each other, and they can certainly spread it to their family, we really are recommending this kids for 5 to 11. There's going to be a vaccine event at Cow Creek today, Friday the 12th, and tomorrow. And they have 300 doses of pediatric vaccine to give to anyone 5 to 11. And then almost all of the clinics in town and all the pediatric offices and many of the pharmacies have the pediatric vaccine. So it should be widely available. And that's good news. The other news is about boosters for adults. Adult boosters are again widely available at pharmacies and all the big clinics. The recommendation is for people 50 and above with underlying conditions, or for people 65 and above to get a booster vaccine. Now, what that booster vaccine is, just boosts your immunity, reduces the risk of hospitalization and death. And booster shots are part of giving vaccines. With almost all vaccines, immunity wanes after a while, and a booster is a good idea to go ahead and boost your immunity. I got mine last Friday after we did this. Felt crummy for about 18 or 24 hours, but was perfectly fine thereafter. So the booster shots are out there, they work, and we're recommending that people get them. The other news that's out there is about variants. The good news is we were worried that after the Delta variant, we would find a new and more nasty variant. The good news is that we have not seen the development of any particularly new variants around. There's a subvariant of Delta called AY4, which we've seen some of, and it doesn't appear to be all that much different from Delta. So what we're hoping is that as we bring the amount of disease down, that we're not going to get new variants, and Delta is what we're going to be left with. Now, Delta is pretty nasty, but we know how to deal with that, and the vaccine works pretty well against that, so we're pretty hopeful about it. So overall, sort of a mixed message, a little worse in the world, a little worse in the US, but getting better in Oregon, staying steady in Douglas County, and we have lots of safe, effective, free, readily available vaccines. So if you haven't gotten in the past, now would be the time to do it. I imagine there will be thousands of discussions over the Thanksgiving table among people who are vaccinated and people who are not vaccinated talking about it. I'm only asking one thing, is please be kind. There are people who believe in vaccine, others who don't. And unfortunately, what I've seen is a lot of nastiness about this. I have tried so hard not to have any nastiness, but to really talk about vaccines as something that can help you. It's something I'd recommend, but nothing that I'm ever going to yell at people or plead about that. Again, this is Dr. Bob Dannenhoffer, Public Health Officer of Douglas County on November 12th. Thank you so much.